Hi guys, it's your girl Riveting Radiance, and by now you probably know exactly what this video is going to be about. A company saw my videos on PCOS and they saw that I was struggling with hair, hyperpigmentation, acne scars. I guess they felt kind of compelled to help me. They figured that no one else was helping me on a professional level and that I was doing a lot of amateur moves. So they decided to reach out to me and help me. It's one of the biggest blessings that I received ever. And the reason why is because my skin controls me. It makes me wear makeup every day. And sometimes I would like to just run to the corner store and pick up an item or two without wearing makeup, but I don't feel comfortable in my skin because of my skin issues. So I was very, very grateful and appreciative when they contacted me. I was very emotional. I actually cried on the phone. I'm not even comfortable going to the pool because if I go to the pool with a full face of makeup, they're gonna be looking like they're gonna do things on a more professional level, whereas with me, I get things over the counter at a drugstore or whatever the case may be. The name of the place is Wake Health Medical Group. I would say they're pretty much gonna come in, rescue me, and save my life. With laser hair removal, they're gonna do 6 to 8 sessions, and it's called folliculitis or something like that when you grow hair. And I have hair like on my chin, on my face, on my lip, on my neck. So they're going to go in for 6 to 8 sessions, and I'm going to start a skincare series. This is going to be one of many videos, but it's going to be a skincare series because I'm going back for a series of facial treatments. Let me just tell you a little bit about the company. They have medical services, which includes acne treatment, dermal fillers, which is kind of like BOTOX. Of course, laser hair removal, Neuse, which is a product on your eyelashes and they'll grow fuller and thicker. They have lipo, they have medical weight loss, and last but not least, skin rejuvenation. Those are the medical services that they offer. They do have skin services as well. They do chemical peels, they do facials. One thing is that they specialize in skin of color, and why that's really important is because if you get laser hair removal, sometimes the laser will mistake our pigmentation for hair because we have skin of color. So sometimes the laser can't tell the difference between the hair and your skin. So with that, you know, you have to have a special type of laser, and if you go to a place that doesn't have that, you can end up with a lot of burn marks. Burn marks actually cause more dark spots and hyperpigmentation. They also do body treatments, tattoo removal, and massages. But the great thing about this company is that a lot of people's insurance cover these type of treatments and they don't even know. With me, I was fortunate enough to get all of my sessions for free. I'm forever grateful. They don't understand how much this means to me and how much this is going to change my life for the better. If someone asked me to choose between having clear skin and having the absolute perfect body, I would choose clear skin. They are very reasonably priced. Even if your insurance does not pay for it or cover it, you still may be able to pay out of pocket, or you can set up some sort of payment arrangement. And that's what I like about them, is that obviously they're very giving and sincere and genuine, because if they weren't, they wouldn't have offered to help me. So in this video, I'm going to go over my entire experience from the time I walked into the door until the time I left, and you're going to see laser hair removal performed. And like I said, I'm going to get about 6 to 8 sessions more. They're also going to do a lot more stuff, like they're going to do chemical peels, acne treatments. They're going to do so much. I have another appointment scheduled for the 18th of this month, and I just went a couple of days ago. So they're really getting in there and taking care of my skin, and it's not like I'm scheduled once a month. No, I'm gonna be going like every week for something, or maybe every 2 weeks. So like I said, this is a skincare series. Don't get it confused with any other series that I have on my channel, because I have a couple of series going on. I have vlogs that I'm posting, I have Trash It or Try It that I'm posting, and then I have these. With my channel, it's very multifaceted, so you're never gonna see one of the same thing all the time. I'm going to do multiple different things, and I'm going to have multiple different themes as well. So this is going to be a skincare series, and this is just the first one of many. Like I said, when I go in to get my chemical peel, I'm going to record that. When I go in and get an acne treatment, I'm going to record that. Everything I do is going to be documented and recorded, especially if you're in the Raleigh, Durham, Cary, Garner, Wake Forest area. You need to check them out. They are awesome. They're amazing. And they're all very beautiful, by the way, because I would expect if you work in the beauty industry for you to look amazing, and they all do. I had a pleasant experience from the time I walked in until the time I walked out. Without further ado, go ahead and enjoy the video. Comment below and let me know, have you ever had laser hair removal? What you think of it? Have you thought about getting it? And just tell me what you thought of the overall experience. If you're excited about me doing a skincare series, definitely comment below, and thumbs up if you're excited about this series, because I'm going to show you everything. And for those of you who aren't familiar with these type of sessions and products, and you're thinking about getting some work done, this is going to be the series you want to watch, because I'm about to get so many things. I just want to document it for you guys and cover it. Again, the company is Wake Health Medical Group. They are located in Raleigh, North Carolina. All the information about this company will be in the description box below. You know, I always am very thorough whenever I do these type of videos. I make sure you have all of the information that you need. So go ahead and watch the video, guys. And this is so near and dear to my heart. I really hope you appreciate it. This is very personal to me, and I want to share this with my subscribers because you guys are like family. You are my riveting rays of sunshine. I'll talk to you later. Bye. So this is my skin before. It's really bad. You guys don't ever see this because I try not to show you. But yeah, this is why I wear makeup. Showing you the before, because they're obviously gonna get it like super clear. And if they do, I won't have to wear makeup. I have an appointment at 5:45.
Where'd you live?
In Raleigh.
In Raleigh? So local gal.
Yes.
Okay, new town. All right. So here we are. Yeah, I see right there. We're going to talk. Because I prefer a mineral makeup.
A mineral? Is that, what is the consistency of mineral? Is that like powder or something?
Some powder. There are a few liquids, but mainly like a powder.
Okay.
Now, one of the brands I like, because it's, you know, sponsored by the American Cancer Society, is Jane Ardell. It's a mineral makeup that has zinc in it. Zinc is great. It's a natural anti-inflammatory. And it has SPF in it that is true SPF that is approved by the Cancer Society.
Okay.
The thing is I don't want your skin getting sun, pretty much. So I want you on a good sunscreen for one, and for two, a makeup that's not going to clog pores or cause any issues.
Yeah.
But how about hair stuff? What are you using in your hair? Because it can affect, you know, especially like with acne that happens here along the hairline. Do you use any like oils or greases in the hair before you go to bed? Like, you know, for now, I'm okay with you doing whatever makeup you have. Don't get anything new quite yet.
Okay.
If I start seeing, hey, my treatments aren't working as well as I'd like them to, then I will start picking on your makeup.
Okay.
Usually I do pick on women's makeup. I like mineral makeup, like Pure is really good, especially for skin of color because it has a good color palette. But, and MAC is good for color-wise. Thickness, I mean, it started as a stage makeup, right?
Yeah.
So it's very thick, it's clogging your pores. I mean, if you look at people who are on stage or in movies or whatever.
Oh yeah, I do use Graftobian and that stage makeup.
That's also tattoo covering.
Yeah, I mean, it's really thick, like.
That's a little too thick. Again, I'm going to be a realist. It's hard to find colors that match. It's hard to find makeup that covers the blemishes that you're concerned about. So I can't pick on it too much, but it can cause some issues. continue doing what you're doing, and then we'll work and see how your skin is getting and how happy you are. And if you start getting to the place that you want, I mean, getting you to fresh skin, it's a process, so it's going to take some time. And some things we do might work, other things we do may not work.
Right. Okay.
And that's the caveat. I need like your complete patience and understanding that this is a relationship. And this is what I tell all my patients. Like any relationship, open, honest communication is a must.
Right.
So some of this is still acne, like you're getting here. This is still acneic in here.
Yeah.
We're just focused on discoloration.
The dark color, and then the hair too. Like I literally like grow hair, like how you have it.
No.
It's not as thick, but it looks like that.
You know, you do have pretty profound folliculitis as well. You know, doing laser hair is a wonderful idea because you can do every treatment on earth. The hyperpigmentation is still going to keep coming back because that inflammation, again, the underlying issues there. So the laser you did in the past?
I did 3 sessions, and it was the type of laser that you can use on African American skin, because what they were saying is that some lasers mistake
your pigment
for hair.
So whenever we do a folliculitis laser hair, which we'll do here, we have a laser that's safe for dark skin tones. I want you to not put makeup on that day. Okay. Just come in first thing in the morning, we'll knock it out, and then go on. I would treat throughout here. Now when it comes to medications for acne, there's a few options with you. Your skin is, though you would think, oh, she's probably oily, you're really not. I mean, do you feel like you're oily?
No.
Okay, I feel like you're almost on the dry side.
Yeah.
Right? So we have to be careful when it comes to the medications. Have you ever used hydroquinone or Ambi or any of those? Like over-the-counter Ambi?
Yeah, I used Ambi before.
Does it irritate your skin? There's medications that help orally that you can take, like spironolactone is one of them. If you ever heard that for PCOS, that helps with the hair growth and the hormones and all that. But again, you're right. Why introduce pills if we don't need to? If you're not getting any of the other symptoms of PCOS, you're not getting cystic acne around your cycle, like right before your cycle, and it's just more the follicles and then this fine macular acne along the edges. We can avoid the oral for now. It's a thought in the back of my head if we're not getting to the progression I want that we can add later. For now, I think doing laser hair is a great idea, and then doing a combination of like a retin-A or a tretinoin on your skin with a bleaching agent. So AMB has 2% hydroquinone, which is over-the-counter hydroquinone. You would want something like 4 or 6%, something higher, a little more potent. The tretinoin in it, the retin-A, helps kill the surface skin and help your skin turn over quicker. So basically, we're kind of peeling off layers by doing that, but it's also helping the acne. So we're treating the hyperpigmentation with that, but the acne is being treated as well. The washes you use are going to be important to me, and making sure makeup is off and not clogging pores because the medicine's not going to get through. Right. Hydroquinone needs to be used at night and washed off first thing in the morning, and then you need to use a very good sunscreen. Okay, like something zinc based. Because zinc is a natural anti-inflammatory. That's why it's in Zicam. That's why it's in Cold Ease. It's going to block that UV rays that are going to cause hyperpigmentation rather than screen it. So I need to block it off. So zinc is my preferred. Something like Obagi or Image, most people do not put on medications correctly when it comes to acne medication or topical medications. We put too much because we just think that's the best thing to do, right? So pea-size amount, and this is probably why I'm so shiny and greasy, because I do this like 10 times a day because my teens always overdo it. Pea-size amount for the whole face, and you just dot it through. Okay. Dot, 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 and then blend it. Okay. Does that make sense? If you
That's
just
how you kind of do foundation sometimes, a little bit, depends.
Good to know. No, I've learned. The thing is that if we don't do that, we're going to put way too much on. And we went just human nature, we're going to squirt it and go right here first, right? And that's going to really irritate here, and that will hyperpigment you, meaning get you more color. We don't want that. We're trying to get it away. So you're going to dot it around like that, blend it, wash it off in the morning, and then put your sunscreen on. I usually tell people who like makeup to use something like this because it has a little bit of tint to it. It is not supposed to match your color. It's naturally tinted with iron oxide, not tinted with a color. So what we'll do is, just demonstrate a little bit back here. But the reason I like it for you is it has a good hydration in it. Don't worry, that color will blend. I know you're already thinking like, what is this man doing? But it just kind of gives you a little glimmer shine. So when women are like ready, when I get them makeup free, if they give me time, I try to get them makeup free.
That would be great.
I like this and a vitamin C because you see how it gives you a nice glimmer.
Like radiant.
Guess what? I'm for SPF 40 and a hydrator. I just have it. It's all in one. Okay. So that's good, and it's a good base for makeup because it's light that you can put makeup right on top of it and not have an issue. I'll give you a sample of that as well. When it comes to face washes, I'm afraid to dry you out too much, a little bit, because dry skin of color is going to bring inflammation, irritation, itching. What follows irritation and inflammation? Color. So then I have more than defeating my whole purpose. I'm going to choose 2 washes that I feel would be appropriate. You try them out for a little bit, see how they go. Okay. We have you scheduled for an acne treatment today, which I think would be helpful. We'll give you samples of the washes and the medication I want you to use at night. And we'll see how we tolerate that. When we do the folliculitis laser hair, we're not going to use that medicine at night for 4 days before we do it. Okay, because I don't want your skin dry. Your skin is, even on the slightest side of dry, it's more tendency to burn. Okay. Make sense? Okay. Do you have any questions so far?
No, but just to make sure, like, you'll give me instructions to
Yes, I write it all.
Okay.
I have a little check sheet there that I check. So like in the morning I would want, like a salicylic base. I like something called Clear Cell. One of the ingredients, not Clear Cell, but Clear Cell is, paraben free, dye free, but it has a good wash to help lift stuff off, but also it's not too harsh on your skin. Now, this is a green tea organic cleanser that I'm giving called Paramedic by Image. I like it because it's a natural anti-inflammatory. Inflammation is part of the problem. Green tea is a natural way to do that. But it does a really good job of actually stripping makeup off to help you. I know you're still going to have to use a wide pore, but it is a good wash to do that. A Clear Sonic wouldn't be a bad idea to use.
I have one.
Okay. Do you use it? No. Does it bother you when you do use it?
It doesn't.
My plan is, just so you don't think like, oh, bleaching cream and laser hair and we're done. My plan is to do some peels, some like cosmetic peels, or a pixel would be even better because that would resurface your skin. We'll try everything out, sample it. We're going to do treatment here with Miss Erica, one of my nurses here. She's going to do some exfoliation. She may do a peel. If we do a peel, we wait a little bit to start your medication. We wait 48 hours to start that topical medication, and we wait 2 weeks to even think about doing any laser. Again, if you're dry, we don't laser. And all that's written out. I'm just having her get the sample, so that's why she has your little homework sheet that I was checking for you. Questions for you so far? I know it's so much information.
No.
Just less is more. I know it sounds crazy. Like when it comes to skin, people just want to put so much on. They're like, I just want to get it better. If I do like 90 steps a day, it'll get better. It has to get better. It's not like that, unfortunately. It's this fine line. If you overdo it and over dry, it gets inflamed. It starts to get irritated. I think that's what happened here one time with you. It looks like.
Yeah, like it's dark right here.
Right, because your skin probably got irritated and flaky and too dry. Hyperpigmentation. Anytime you get irritation, hyperpigmentation, that's just skin of color with melanocytes. It's a protection mechanism. So we want you to get a little dry and a little flaky with the medications we're giving and the treatments we do, but we don't want you to get irritated dry. There's a fine line there. I'll have Erica start your treatment here shortly, and then if you have any comments, questions, whatever, just let us know. I'd like you to do a laser treatment. Let me talk to her and get samples. So we are going to do this treatment now, and then we'll repeat it about 4 to 6.
Okay.
This is Erica. She's one of the nurses here.
Hi. Nice to meet you. Nice to meet you too.
What settings we need to be at, and then Erica will probably do your acne treatments.
Okay.
Okay?
Sounds good.
Pleasure to meet you.
So you get to wear these awesome glasses here.
Okay.
You're going to feel some cold air. That's part of it, right?
Mm-hmm.
No makeup on now.
No, and I didn't put moisturizer or anything. I washed it and then I just came.
So I'm going to just do one spot right there just to show you. Now, in between treatments, and you're not going to like this, but I need you to shave.
Okay.
Okay? I have a...
So don't wax.
No, because what the laser hair is, I need a dynamite shaft, you know, the little stick of the dynamite stick. I have to ignite that and then bust the hair follicle. If you pull out my the follicle, I can't light anything.
Right.
Does that make sense?
Yeah.
So right now we have just enough to do stuff with it, but in between we have to shave.
Okay.
I know.
I'll use my husband's razor. He'll probably be like,
I'm gonna also give you some something called 10 skin to use so you don't get razor bumps. Because that's,
yeah, because it happens when you shave, right?
Correct. Alright, 3, 2, 1. I'm doing one zap just so you know how it feels.
Okay.
How'd you do?
That was fine. Oh gosh.
You doing okay?
Yeah.
Doing alright?
Yeah.
Is this different than what you did last time?
I don't think I can talk to you.
Right. Get it done? I'm so sorry. Does it hurt that bad?
I mean, it feels like, no, it's like, yeah, it feels like, no, it feels like you're stabbing me with, like, needles.
Maybe a little too intense.
Maybe I'm exaggerating, I don't know. But
So
it did feel like this, but I don't know, I can't remember, but I'm pretty sure this is what it felt like.
It's going to be a lot more sensitive through here.
Oh gosh.
Okay, I can turn it down.
Well, if whatever is more effective, I'll endure it.
I'm okay with less effective and more treatments.
Okay.
And that's okay. I'd rather you be comfortable and not have pain and scarring or burning or any reactions like that. If we have to do another 2, 3 more treatments, it's fine.
Okay. Do you do the lip? Because I know that's going to be like up here.
Yes.
That's going to be like, oh my gosh.
This is going to be worse.
Oh, is it?
Yeah, just because of the density of the hair.
Yeah, and that hurts. That hurts anyway. Like, yeah.
Because you still have those cysts. Alright, tell me, is this any better now that I turned it down a bit? Not really?
Yeah, it's better.
You tell me if you need a break.
Okay. Ooh. The things we do. But yeah, it's better than walking around with a beard. People don't know if you're like a man or a woman.
No. I've seen much worse, and I'll maybe till you chin up just a bit. This is the tough part, okay? I'm going to do down here and work my way up. Just be nice and cool for a second. Alright, 3, 2, 1. Tell me when you need breaks.
Okay. No, I didn't need a break. I was just saying yes.